Yeah. Is it recording now?
Yes, sir.
Yes, sir.
Yeah. Okay.
Yes, sir.
Yeah. Uh, a very good afternoon, all of you. We will not waste much time discussing on the other things. I hope everybody is well. So what we're going to do is we're going to start a new chapter, salivary gland disorders. We'll go in brief and we'll cover all the important points. Coming to the introduction, probably you must have already heard and listened from oral pathology, oral medicine, and again we'll be doing it in surgery. The three major salivary glands you all know: parotid, submandibular, and sublingual glands. These are glands that secrete a high modified saliva through a branching ductal system. Okay. There are also thousands of minor salivary glands throughout the mouth, most of which are named because based on their anatomic location. There are salivary glands which are based on the lips. They are called labial, palatal, buccal mucosa, etc. These minor salivary glands are located just below the mucosal surface. You have your mucosa just below the mucosal surface and communicate with the oral cavity through short ducts. Okay. Coming to the saliva, which is the product of the major and minor salivary glands, which is dispersed throughout the oral cavity. It's a complex mixture of water, organic and non-organic compounds. Let's see what is the composition of saliva. Saliva includes water, which is a major component of 99.5%, and other 0.5% of solids, which include organic. Inorganic includes like sodium, potassium, calcium. Organic includes mucin, one important, radikinins, kallikrein, lysosomes, immunoglobulins, and other things. The functions of saliva, this usually comes as a 2 marks question, as 4 marks question in a final year exam. So you just need to understand the basics of physiology. Saliva protects the teeth, esophageal mucosa through a number of mechanisms, maintains the integrity of tissues. It functions in regulation to the digestion of the upper IGT. Then it facilitates food intake and clears and dilutes the food debris and bacterial matter, rinses the mouth, lubricates and swallowing. A small clinical examination, how do you see if you do not have sufficient amount of saliva? That is, patients usually show with a mucosal dryness. There will be an increase in erosion and caries, candidiasis. There's a sign known as lipstick sign, where you see the patient is having lipstick which is left over onto the teeth. Saliva is there, it removes the whatever substances present on the teeth. But if it is decreased, then you will see this sign. Another examination is the tongue blade, where if an examiner holds the tongue blade or the wooden stick against your buccal mucosa, if it is dry, the mucosal blade or the tongue blade shifts to the, is lifted away along with the mucosa. So these two shows us there is not enough amount of saliva. So this condition where there is a decreased amount of saliva or due to the reduced salivary flow in the salivary composition is known as xerostomia. So xerostomia is sometimes otherwise called as cotton mouth or pasties, where and people who are actually smoking marijuana or hangover usually have this symptom the next day. The causes of saliva. I mean, xerostomia is usually asked for a 4 marks question. So you should know the important things, the causes, underlying causes such as Jogres syndrome or poorly controlled diabetes or any underlying diseases can be a cause. Other causes include some side effects of drugs, or trauma to the salivary glands or ducts or nerves. All these are patients who have undergone radiotherapy, excessive mouth breathing patients. All these patients will show the xerostomia or the dryness of the mouth. Usually caused by the drugs, medicines such as autoimmune diseases, just now we have discussed, like neurological disorders, people like cerebral palsy, Bell's palsy, infections like hepatitis, other conditions where there are surgeries which are done on parotid or submandibular or menopause patients or aplasia of the gland where the gland is not there. What are the signs and symptoms? Oral mucosal dryness will be there. Patient will have a dry mouth. The dry rhino, patient will be exhibiting some burning oral sensation. There will be difficulty in speech, difficulty in swallowing, all the difficulty in chewing food, and difficulty in attaining. What are the oral complications of xerostomia? Patient is having a xerostomia. He shows there is a dental caries because the saliva usually removes all the dust particles,